It's really a pleasure and honor for me to be visiting here at Intermountain, because Intermountain Healthcare has been an early and important leader in the field of measuring what we do internally as a healthcare system on behalf of our patients and using that data to drive improvement and understanding the central importance of the data loops that need to be in place, that need to be trusted by the providers for that to work. So you've been at it a long time. The rest of the nation is learning how to do this, and I'm really pleased to be here. The National Quality Forum is a unique organization that represents the complexity of the American healthcare system just in its entirety. So we have a system that includes government, both federal government and state governments. We have a system that includes private sector, private insurance companies and health plans, hospitals, physicians, nurses, pharmacists, and other providers, and businesses and purchasers who actually buy healthcare directly or through another payer for their employees. And of course, the most important person, the patient and the consumer, is also an important stakeholder in healthcare. So the National Quality Forum, NQF, is set up to have every one of those stakeholders around the table represented on our board of directors with a majority of consumers and purchasers, so that we're saying the people who are the buyers of this product, which is healthcare, and who really stand to be the recipients of it, should have a majority voice in how healthcare quality standards are developed, and most importantly, how quality is measured. There has been a very dramatic acceleration of the healthcare quality interest levels among all these stakeholders, and I call it the quality movement. Many people do. And it has really been stimulated by the fact that we now have better quality measures and better ways to actually create report cards of people's performance. Some people think actually we have too much of this kind of information out there because particularly for consumers, it's confusing. It's not always clear which are the legitimate measures and which are just advertising. And so I think the next level for this movement, the first level was to make information available, and it is very much available now. And it actually has worked, because many times you make information available about quality, and providers, good hospitals and good physicians and healthcare organizations want to get better. Nobody wants to be at the bottom of anybody's ranking, right? So there's real motivation to learn how did they do that? How did they get better? And really try to learn from the leaders in the field to improve. But now I think there's an important role for making more sense out of this information, and frankly, getting rid of a lot of the noise that doesn't really contribute to consumers really understanding what is the most important thing for them when they're trying to buy a health plan or decide what hospital to go to. For the general public and the informed public, as painful as it is, I think it's really important to learn what are the trusted sources of quality information. And you see this sometimes on the internet. You know, there's all kinds of information available on the internet. But if you go to organizations that are set up to professionally and in a non-self-interested way put out information that is publicly available, that's probably one of the most important things. You don't have to buy it, but it's out there and it's been vetted by someone. So there's a standard that information is valuable. The government has a hospital compare website, nursing home compare website, and a growing physician compare website. So I would say that for it to go as a starter onto those websites and look at the hospitals and nursing homes. They're actually widely used now by families seeking a good nursing home for a family member, for example. Well, those folks are actually in the care delivery business. The health professionals and the people who run and manage hospitals, for example, need to know a lot about this information too, because the measures that are publicly reported are meant to be standardized, and that's for good reason, so that the consumers can compare across different organizations. But sometimes that's not a detailed level of information that's really going to help me in my clinical practice know where I really need to improve. So I need to have my electronic health information records and my health system that I work for help me get more meaningful information at the basic point at which I'm actually taking care of patients. Now, the goal, and something that I really think we should be able to do with modern electronic information, is to use the same information for both purposes, so that you're not having to create separate reports for the public and then separate reports that are detailed enough that you can actually use them for improvement.